Senator Kennedy was above all a pragmatist. He understood that whatever could get through the process would not be his perfect vision. And he hoped that what could get through the process would be good enough to address the basic needs of Americans who can't find and obtain affordable health insurance coverage. And I think he would be very proud and very pleased with the law that President Obama signed on March 23rd. It will result in coverage for about 32 million Americans right now who don't have coverage. And so I think he would take enormous pride in this and be very pleased with the result, and also recognize that this new law is itself not the end. It is another step, another stage in the process. And just like the Social Security law in 1935 was amended repeatedly in the following 25 years to fill in holes and gaps, in the same way this new law will be corrected, fixed, improved repeatedly over the next coming decades. The area I think that people will be most concerned about is dealing with the affordability of health insurance. And whether or not the subsidies that will be available to people will in fact be adequate to make the purchase of insurance genuinely affordable for folks who have more limited means. And so that is going to be a constant work in process. The other key piece is that the law makes serious and good faith efforts to get control over rising costs within the healthcare system. But I think most people would agree it hasn't found the best, most effective mechanism to do that. And so one of the areas over the coming years that will have the most focus is how can we as a nation get better control over rising healthcare costs, because that is creating serious distress for Americans who are paying health insurance premiums, whether on their own, through their employers, or through government. And it is also destabilizing many other aspects of society that also need support, like education, environmental protection, roads and bridges. We have an urgent national need to get a handle on rising healthcare costs, and this law makes some good, important steps and doesn't provide the meaningful long-term solution that's going to be necessary. That is going to be a process, and that work is still very much ahead of us.